Good morning, everybody. On behalf of the Agency for Healthcare Administration and our Health IT initiatives, I'd like to thank everyone for joining this morning. My name is Chris Wilkie, and I'm the Health IT Outreach Specialist here at ACA. So as you know, today we're going to be talking about e-prescribing in Florida. There have been some legislative changes that affect e-prescribing, and today we're going to discuss those along with get a view of the current landscape of e-prescribing nationally and in Florida. We are lucky to have an experienced panel of experts with us today. It sounds like someone's phone is on. If everyone could go on mute for right now, that'd be great. Thank you. So we're lucky to have an experienced panel of experts with us today. But before I get into their introductions, I just want to share a few pieces of information with you about what we're doing here with e-prescribing and health information technology at the Agency for Healthcare Administration. So on this slide, you can see a few of our health IT initiatives. ACA governs and promotes health IT, including the administration of the Electronic Health Record Incentive Program. Not only administers the program, but we provide information to Medicaid providers on how they can meet meaningful use requirements with the goal of improving safety, quality, and efficiency, and also reducing health disparities. We also help them engage patients and families in their care and work on improving care coordination. Here at the agency, we also promote telehealth, and we have a section on our website that informs providers on how they can start implementing telehealth solutions in their own practice. Today, as you know, we're here to talk about e-prescribing. That's another area of health IT that we like to promote. And I'm going to talk a little bit more about some resources we have available to patients and providers on our website. And lastly, founded in 2011, the Florida Health Information Exchange has been facilitating the secure exchange of health information through several services between providers, hospital systems, and payers. Here at the agency, we govern the Florida HIE by setting policy, we convene stakeholders, provide federal oversight, and also engage our federal partners. We really are excited about promoting the benefits of health information technology and have a wealth of resources available to you on the ACA website. One such resource is the brand new ePrescribing Clearinghouse. This just launched last month, and at this website, you can see our statewide adoption and use trends. You can check out metrics related to quarters of the year, and you can look at a comparison of Florida to the national e-prescribing rates. Just a couple little stats here. Florida has seen a steady increase in e-prescribing since the inception of the initiative in 2007. And we started collecting data for controlled substances e-prescribing in 2015. This website, I'm going to bring it up on your screen here. You can reach at aca.myflorida.com/SCHS/ePrescribing. As I said, this is a brand new website. It's got some news to the federal and state changes, which we will discuss today. And you can also check out our metrics and reports. We've got them since we started keeping them. And we've got resources and frequently asked questions available as well. All right. Well, without any further delay, let's get into the meat of today's presentation. I want to start by introducing our panelists. First, we have Dr. Paul Glisson. Dr. Glisson currently serves as the Vice President of Medical Affairs at Baptist Healthcare in Pensacola, Florida. He brings over 10 years of healthcare experience to his role at Baptist with knowledge in physician leadership, quality initiatives, and change management. While still practicing emergency medicine, he has responsibilities for leading the medical staff, clinical safety, case management, clinical documentation improvement, and palliative care. His overall focus is on improvement for health systems, patient safety, and achieving zero harm. Thanks for joining us this morning, Dr. Glisson.
Thank you for having me.
Sure thing. Next on our panel, we have Michael Jackson from B-Farm. Michael Jackson is a licensed pharmacist in both Florida and Alabama for over 37 years. His practice experience includes independent and chain pharmacy, as well as hospital and veterinary hospital pharmacy. He has management experience, including responsibilities for over 58 pharmacies in the state of Florida, Alabama, and Mississippi. He has also served on various state councils and boards, including the Drug Utilization Review Board, Collaborative Drug Therapy Management Task Force, and the Florida Health Insurance Advisory Board. Michael Jackson, thank you as well for being here this morning.
I appreciate you letting me be here today with you.
Sure thing. All right, third on our panel is Jennifer Wenold. Jennifer Wenold was appointed as Executive Director in 2015 to serve the Board of Dentistry, Clinical Social Work, Marriage and Family Therapy, and Mental Health Counselors. In February of this year, Jennifer accepted the opportunity to serve as the Executive Director for the Board of Pharmacy and the Board of Dentistry exclusively. She has worked in healthcare regulation for the past 15 years, and prior to that, practiced as a clinical social worker in the acute care setting. Hi, good morning, Jennifer. Thank you as well for being here.
Thank you. It's my pleasure.
All right. And rounding out our panel this morning is Ken Whittemore. Ken is Vice President of Professional and Regulatory Affairs at SureScripts. SureScripts is the nation's largest health information network. Pharmacies, payers, physicians, hospitals, health information exchanges, and health technology firms rely on SureScripts to easily and securely share health information. Ken's responsibilities at SureScripts include monitoring and influencing state and federal laws and regulations related to health information technology. Ken, thank you, sir, for being here this morning.
It's my pleasure.
All right, great, folks. Well, with our introductions out of the way, let's go ahead and get into some questions. Ken, I want to start off with you and ask you, what's the current state of ePrescribing adoption throughout the United States and specifically in Florida?
Okay. So there are two ways you can approach this. You can look at the volume of prescriptions that are going electronically, and then you can look at the ability of prescribers and pharmacies to send and receive electronic prescriptions. So we'll start off with some national numbers. And these next couple of numbers that I'm going to share with you are actually from December of last year. Every year we issue a report that shares statistics with regard to ePrescribing and a number of other health information technology parameters. As of the end of last year, about 85% of all prescriptions were electronic. If you separate out the non-controlled prescriptions, they were about 96% of non-controlled prescriptions were going electronically. And then if you look specifically at controlled substances, at the end of last year, it was about 31%. So that's at a national level. I don't have the statistics at the end of last year for Florida specifically, but I think that'll give you a sense of the way things are looking. With regard to providers and pharmacies, we can get specific with regard to Florida, so we'll talk about that a little bit here. I always like to start with pharmacies because the way things have worked out, the pharmacies are just much more prepared and ready to receive electronic prescriptions, including electronic prescriptions for controlled substances, than are the providers. And there are a lot of reasons for that. I'm not trying to point fingers at anybody, but it's just a reality. So if you look at the way things are right now, in the state of Florida, 99.1% of pharmacies are capable of receiving electronic prescriptions. So it's almost universal. Only about 40 out of the roughly 4,500 are not capable of receiving electronic prescriptions right now. And there are probably some very specific reasons for that. If you look at whether or not pharmacies can receive electronic prescriptions for controlled substances, well, let me digress just a minute. So that 99.1% actually is better than the national average. Currently, the national average is 98.4%. So kudos to Florida pharmacies for really being on top of things. If you look at controlled substances, or the ability of pharmacies to receive controlled substances, it's slightly less. In Florida right now, it's about 95%. So there are over 200 out of the 4,500 pharmacies in the state that are not currently able to receive controlled substance prescriptions. So there's a little bit of concern there. It is something that should be easily remedied, but that's the current state. If you look at providers, you get a different picture here, and that gets a little bit more intricate, if you will. We have, and I'm just going to round these numbers off just to make the conversation a little bit easier. There are close to 56,000 active e-prescribers in the state of Florida out of about 78,000 potential prescribers. So that's about 71% of the universe that we expect to maybe be prescribing is actually doing it. At a national level, that's about 78%. So it's slightly less than it is at the national level. If you look at physicians who are able to e-prescribe controlled substances, however, both nationally and in Florida, that number is much lower. And the primary reason for that is there are additional steps that a physician with an EHR has to undergo in order to enable themselves to e-prescribe controlled substances. So currently in Florida, there are about 17,000 docs or other prescribers that are capable of transmitting controlled substances electronically. Again, out of a universe of 78, that's about 22%. That's versus the national percentage of 45%. So with regard to their ability to transmit controlled substances electronically, Florida prescribers are substantially behind the national level. One other thing I would want to point out, though, is that if you look at the number of prescribers who have EHRs, are able to prescribe, and are using a system that is currently certified and approved for transmitting EPCSs, as we like to call them, that's about 51,000. So if you subtract the 17,000 from the 51,000, there are about 34,000 prescribers who are currently using an EHR capable of e-prescribing, but either their software company hasn't rolled the functionality out to the docs, or the docs have not, and other prescribers haven't done what is necessary in order for them to become authorized to e-prescribe controlled substances. So I think that's probably a pretty good starting point in terms of giving you a sense of where things stand right now.
Yeah, absolutely, Ken. I had a question. When you were talking about some providers having the ability to e-prescribe, you also mentioned that some pharmacies in Florida are not able to receive controlled substances. Can you speak as to why that is? Is that an issue of technology adoption?
I think at this stage of the game, it is. If you look at the pharmacy software vendors that are available, and there's still about 80 of them in the marketplace, virtually all of them have enabled their systems for that. So it's probably just that pharmacies haven't updated their system, or they also have to be identified in the pharmacy directory that we make available to the EHRs as pharmacies that can receive an EPCS. So it could be either the technology, or they're not properly identified in our directory. But for the most part, on the pharmacy side, it's something that should be easily remedied.
I see. And I want to let our panelists know, although I'm directing questions to specific members, if anyone else has anything to add to a specific question, please feel free to jump in. Ken, this next question is also for you. So I'm aware that there were some changes to the regulations related to Medicare and e-prescribing this year. Are you able to share with us what those changes were and how they may impact practitioners?
Sure. So it's interesting timing in that there are things going on at the level of CMS and their regulations, and then you also have things like you folks are doing in Florida and some of the other states. One of the very, I'll even call it momentous things that are going on is that the industry is moving to a new version of the National ePrescribing Standard. This standard was created by an entity known as the National Council for Prescription Drug Programs. And it gets a little arcane in terms of how this works out regulatorily, but the bottom line is basically that CMS is responsible for determining what version of the e-prescribing standard will be used for Medicare. And because that is such a large program and so many people participate in it, both in terms of providers and pharmacies and whatnot, when CMS says it's time to move to a new standard, that in effect means that the industry moves forward and we'll use that standard across the board for all patients. So this new version of script is due to take effect on January 1st, 2020. So just a couple of weeks. And we've been working very closely with the EHR vendors and the pharmacy vendors and pharmacies that are direct connected to our network to get them prepared for this transition. It is going to greatly improve the e-prescribing process. It's going to address a lot of the issues, some of which are, I think, addressed in the bill that was passed in Florida in terms of exceptions, that are really going to improve the process. So it's a good thing, but it's also a very significant change, and so there may be. We're hoping that there won't be any hiccups come January, but there will, there'll probably be a couple small ones. To give you a sense, the moving to the new version of the standard does two basic things. It is enhancing and expanding the utility of portions of e-prescribing that are already available, and then it's also making some new types of transactions available. To give you a couple of examples of the first, one of the things that we've heard a lot about is the size of the SIG field, or where physicians put instructions that are to go on the prescription label. Currently, that field is limited to 140 characters. In the new version of the standard, it's being expanded to 1,000 characters. So that's going to remove somewhat of a pain point, because there have been many instances over the years reported to us where physicians have been stymied in their ability to fit the instructions in 140 characters, and they've had to resort to abbreviating and truncating and those kind of things. We hope there aren't too many SIGs that go to 1,000 characters, frankly, but at least expanding it beyond the 140 characters is going to be beneficial to the process. Another improvement is the e-prescribing standard has never really been designed to convey information about compounded prescriptions. And with the new version of the standard, there is a module built into it that is specifically designed to carry that kind of information. So that too is an improvement. On the other side, in terms of newer transaction, one that is known as RX transfer, which will allow pharmacies to electronically transfer prescriptions between them, which typically now is done via telephone, as I think a lot of folks on this webinar are aware. That will be available as one of the new functionalities of the new transaction the new standard that we're moving to. I work with one of my colleagues with the National Community Pharmacists Association to write an article that kind of summarizes what's going to happen with the new standard, and I did share that with you folks, and you can feel free to share it with anybody who's listening in on the webinar. The other thing quickly that I'll mention with regard to CMS and at the federal level is the requirement of the Support Act that was passed a little more than a year ago, that e-prescribing for controlled substances be mandated for the Medicare Part D program. That's going to take effect January 1st of next year, so 2021. So a lot of activity in terms of these types of requirements, both at the state and federal level.
Absolutely. Sounds like a lot of good improvements in the queue. And as you said, hopefully those can be adopted with minimal hiccups along the way. Zooming in to the state of Florida, Jennifer, my next question is for you. There was a new law that was passed this year that affects practitioners that prescribe in Florida. What do Florida's healthcare practitioners need to know about this new law?
Thank you very much. House Bill 831 on electronic prescribing was signed into law by Governor DeSantis, and its effective date is January the 1st of 2020. The bill provides new requirements for prescribing practitioners to generate and transmit all prescriptions electronically if they maintain electronic healthcare records, including controlled substances. Our prescribing practitioners must comply with this new law upon license renewal or by July 1st, 2021, whichever is earlier. The new law requires our prescribers to generate and transmit all prescriptions electronically unless the practitioner and the dispenser are the same entity. The prescription cannot be transmitted electronically under the most recently implemented version of the National Council for Prescription Drug Program script standards. The practitioner has been issued a waiver by the department not to exceed 1 year. The practitioner reasonably determines that it would be impractical for the patient in question to obtain a medicinal drug prescribed by an electronic prescription in a timely manner, and such delay would adversely impact the patient's medical condition. The practitioner is prescribing a drug under a research protocol. The prescription is for a drug for which the Federal Food and Drug Administration requires the prescription to contain elements that may not be included in electronic prescribing. The prescription is issued to an individual receiving hospice care or who is a resident of a nursing home, or the practitioner determines that it's in the best interest of the patient, or the patient determines that it's in his or her own best interest to compare prescription drug prices among area pharmacies. And then the practitioner must document that determination in the medical record. That's House Bill 831, a summary in a nutshell.
Yeah, definitely some important news to get out there. Jennifer, is Florida Health doing anything specifically to get that information out to practitioners?
Thank you for asking. We have had a slider on the prescribing board's website and pharmacy's website for electronic prescribing. If you click on that slider, you will be taken to a summary of the bill and then frequently asked questions that we've been developing. We've also been making this information available via communication we have during renewal for our prescribing practitioners, through our association partners, through board meetings, all of our avenues that we use to communicate this change to our prescribers.
Excellent. Thanks, Jennifer.
You're welcome.
Michael Jackson, what do you feel the impact of this new law will have on pharmacies and pharmacists here in Florida, and how can they prepare for the change that's going to come up?
Thank you, Chris, and also season's greetings to everyone, and appreciate you allowing me to address the group today. So for pharmacies, the new law itself was something we studied very carefully, and over the years, written prescription as we know it today, and this is some 10 years ago, I felt that it would be something that you will only find in a museum somewhere. Well, everybody thought I was nuts, but now not so much today because the growth of electronic prescribing. So with that, what we've learned in our side of the industry is that electronic prescribing does create some efficiencies and some economies of scale because we're not having to transcribe information that we're getting that's written or called in or orally transmitted to a pharmacy or faxed into a pharmacy. That information is coming into our systems directly from the prescriber. So those are some good things. Some of the financial issues I think pharmacies are concerned over is that every electronic prescription that a pharmacy receives, whether it's filled or not, results in a financial transaction to the pharmacy. So it's not much per prescription, but it's nonetheless an impact fiscally on each pharmacy. Now, I think there was a question earlier about why not 100% of all of our pharmacies are enabled to process electronic prescriptions. And when you're looking at a head count of some 4,600 pharmacies statewide, you're going to have a few that are not going to be set up for this. Those probably are pharmacies that are serving the indigent. They have very limited resources, and in some cases, they may be doing a lot of things manually or not receiving, not processing prescriptions electronically for purposes of payment or anything like that. So they're not electronically enabled. But I think in time, eventually those will find a pathway to that area. So one of the things that we've also realized with the exceptions that's in the new law, that we were interested to know whether or not pharmacies and pharmacists have to be familiar with the exceptions that physicians are going to be utilizing. And in many cases, pharmacists and pharmacies are not going to know whether or not a prescription that is issued on paper to a pharmacy is pursuant to any of these exceptions. And so we actually had good dialogue with our Board of Pharmacy, who took the position, I believe, that it's not the duty or responsibility of a pharmacist to determine whether or not an exception is in place. And this was kind of important because we were concerned that in the payer market, in the PBM marketplace, that pharmacies would be held accountable should they process a prescription that was not transmitted electronically and arrived in the pharmacy by paper. And it became pretty clear that that is not the case. So we're grateful for that. We're good. We're appreciative of the Board of Pharmacy having that dialogue and clearing that up for us. Now, having said that, as Ken mentioned earlier, the metrics are really good for Florida. I mean, we're right up against the national average in terms of the pharmacy side being available and prepared for this, and we're only a few percentage points from getting to 100, and that's what I think our goal is.
Absolutely. Thanks, Michael. It's always good to get the pharmacy perspective there. Kind of flipping it over to the providers, Dr. Glisson, how are hospitals working to implement the new law requirements? And what do you think the impact of the new law in Florida will be for providers?
Well, every new law means new software updates, and all that means money for hospitals, and it doesn't mean thousands or hundreds of dollars, it means millions. For my personal system, it requires a major software update just for the entire EMR to be able to support this new version of SureScripts. And I think that software update's around $5 million for us to get the entire package into it. Of course, that new software requires new hardware, new servers, faster this, faster that, and so there's a capital component to that as well. And the big thing that we haven't even seen yet is the workflow. Now, I get there's technology to deal with, but there's also the workflow of what happens in a physician's office and in the inpatient settings. And I haven't seen the software to work to even know what the workflow will be. So we still have a lot of questions. Some workflows in offices, they have medical assistants or nurses handwrite the prescriptions and kind of have them ready to go, or they're just ready for signature to be checked. There are others that have electronic EMRs and things like that, where they set those up and they have assistants to help them with that, or physician assistants or nurse practitioners set those up for them. So I haven't seen the workflow work because the software is not even available yet for us to look at. And then there's the after hours workflow. So many prescriptions are called in, not even handwritten, but called in on the phone on weekends and after hours to expedite the workflow for taking care of patients. And that no one's even looked at that yet, how we got that there. So I'm actually surprised the numbers for physicians are as high as they are, because we haven't been able to fully explore it, at least us in the Panhandle. There are a couple of other issues that are concerning for us. In our area, it's pretty high employment rate for physicians. So I think there's more employed physicians for big healthcare systems than there are independent physicians. And I know that independent physicians have to bear that cost themselves. And that can be pretty complicated for them to navigate that. And then if they're an employed physician, like for us, they cannot help it. It's not their responsibility to get the EMR up to date. So I know we're going to be applying for waivers, because there's no way we can make we'll be lucky to make it by January 1st of next year to have all this in place. But that's not the physician's fault or their responsibility. So they're kind of they're just along for the ride for that. And then the last thing I wanted to mention too is about our current population. And we've talked about the pharmacies and the prescribers, but we really haven't talked about the patients. And I don't work throughout the entire state of Florida, but I can tell you in the Panhandle, at least, there's not a very high demand. There's no patients that come in and say, I demand that my prescription is e-prescribed and sent over so I don't have to wait in the line. They probably should be asking that, but there's not a lot of demand for it. And then if you do try to e-prescribe some of these, there's an educational component along with that to say, just like Mr. Jackson was just talking about there, is that, if I prescribe it for you, I need you to go pick it up. And yes, it's at the, it's the Walmart pharmacy on Brent Lane, not the one on Palafox. So they know where to go, and that's not interchangeable. So there's a whole component of education for the population that no one has addressed yet. And that's going to fall on the physician as well. And then also the feedback I get from physicians, and, I'm not saying this myself, but as their conduit or their voice here, what I hear is that the physicians now say, well, I'm now the secretary. So I can write everything down. I can check the patients in. I can do the billing. I can write their prescriptions. I can go hand deliver it to them. I can educate everybody and then document it in the record. So what do I need anybody else in healthcare to help me with? Because eventually I'll be doing it all. So we have to, there's some education component on the provider's part as well.
Thanks, Dr. Glisson. Really valuable provider perspective right there. And I wanted to kind of ride on your last point there. We have heard the pharmacy side, we've heard the provider side and how they're going to be affected. It's like you said, a lot of patients, they're not demanding these prescriptions. So let's say we're at the point where e-prescriptions become the norm. And this is a question for anyone on the panel today. What type of concerns do you think are going to arise from the patients? And this is beyond just kind of educating them about how they can get their e-prescription. What kind of concerns do you think a patient might have just about e-prescriptions in general?
This is Michael Jackson, and I want to maybe piggyback off of what Dr. Gleason said to try to get to the answer to your question here. So there is a minor quirk in Florida laws that I think may create a little bit of a barrier, especially when it comes to the electronic prescribing of Schedule II controlled substances. And the weird thing about the law is that it's under 465.026. It talks about the transfer of prescriptions for medicinal drugs for Schedules 3, 4, and 5 appearing in Chapter 893. And I think there's also something in the federal regulations that allow for transferring of prescriptions. But the challenge, I think, is that how does that work for Schedule II drugs that have never been filled? So, and I think some pharmacies are kind of conservatively interpreting current Florida laws by just not allowing for the transfer of prescriptions that have arrived in a pharmacy electronically, which I think the federal law allows for prescriptions that have arrived in a pharmacy that have never been filled to be transferred. But state law is kind of a little bit more restrictive when it comes to that. So there may need to be a tweak to state laws to clarify that electronic prescriptions that are transmitted to a pharmacy that need to go to another pharmacy to allow for that, as the federal laws do allow for that. I don't know if that confuses everybody, but that's kind of what I think pharmacies are running into today.
I think that's a great point to make. I'm going to shift gears here a little bit, folks. Jennifer, this next question is for you. As part of Florida's new e-prescribing law, Florida health practitioners can get a waiver for implementing this provision. How can they learn more about the waiver process?
Thank you. We have made available on just yesterday, so if anyone had been following us, obviously the waiver is going through the department's rulemaking process. But what they can do is go onto their respective board's websites. It's under the resources tab. We have posted the waiver form. A practitioner can be granted a waiver not to exceed 1 year for demonstrated economic hardship, technology limitations that are not reasonably within the control of the practitioner, and any other exceptional circumstance demonstrated. And we're trying to make this as simple and easy as possible. It's a one-page form. You'll be able to download that. It's a fillable PDF right now, and you will fill that out and just submit it to your respective board office. And what I mean by that is if you're a physician, it will go to the Board of Medicine. If you're a prescribing dentist, it will go to the Board of Dentistry, so on and so forth. And then that will be processed. You'll get an approval letter. It will be scanned into your system. We're working on making that a modifier that will be on the license lookup page, so somebody will be able to easily determine whether Dr. Glisson, for example, has a waiver. The waivers, one of the questions that we have been getting is since this law is specific to our practitioners, the waivers will be issued as such. So we're going to try to make it simple for those hospital systems. We're going to work closely with large practices and things like that for the reasons that Dr. Glisson explained, and make that simple for them. And they can simply fill that out and send it via email. We are going to be asking on top of a renewal some questions related to electronic prescribing. And if you answer that you need a waiver, we'll link you to where you can obtain that, so that it prompts the practitioner to think about that during renewal, whether or not they need a waiver for electronic prescribing.
Awesome. Thanks, Jennifer. Let's see, Ken, for those who are working to implement ePrescribing, I had two questions. First is, how does a provider know if their system actually allows them to prescribe electronically? And to follow up on that, how do they know if a pharmacy can receive the prescription electronically?
Sure. So with regard to a provider who has an EHR, this is a question that they would have to pose to their EHR representative. They may have already been, information may have already been shared with them, but if it hasn't been the subject of conversation with them, that would be the first thing that they should do. They can also, we do keep a tabular listing on our website of all of the EHR applications that are connected to our website and are approved for certain services, and one of them is ePCS. So if you go on our website and you look for, and I don't want to name any because I don't want to slight anybody, but there are currently over 300 different EHR companies connected to us, and because many of them have more than one application, the actual number of applications connected to us is much higher than that. But that's one way that they can determine it quickly. Have a member of their staff go on our website and do that lookup. One thing I would like to share at this point, we mentioned that there are I think it was 17,000 or so that have an EHR but currently aren't enabled for ePCS. Recognizing the difficulty that a lot of practices have in really determining, okay, what do I need to do in order to become enabled? We created an informational website a couple of years ago, and it is designed, it's not a marketing website other than naming us at the bottom. There's no marketing materials on it. What it does have on it, though, is 2 5-minute videos. One of them is designed for solo and small medical practices, and the other one's designed for health system affiliated practices. And if one watches one of those videos, that basically shares the 4 basic steps that providers need to undergo in order to become enabled to e-prescribe controlled substances. The website's it's very simple. It's getepcs.com, getepcs.com. So I just wanted to make that information available for those who really don't know what the next steps are. In terms of how a provider would know if a pharmacy to which they want to e-prescribe can receive an electronic prescription, I would go first back to the statistics that Michael and I have shared, which is almost all the pharmacies are capable. But if they want to be sure, their EHR on a very regular basis, their EHR company downloads a pharmacy directory from us, and that is what informs the EHR and the users of the EHR whether or not a pharmacy can even receive an electronic prescription, because if they're not in that directory, they can't. And then two, whether they can they're prepared to receive an electronic prescription for a controlled substance. So that's how they would address that particular question that you asked.
Great. Thanks for the information, Ken. Really helpful right there. This next question is for anyone on the panel. As we see ePrescribing become more and more mainstream, and patients may be hearing about their provider switching to ePrescribing, how can you address a patient's concern about security? Because whenever something goes from paper to electronic, that's always a concern that's at the forefront. What would you say to a patient who's concerned about the privacy or security of their prescription?
Well, this is Ken again. I probably can address it from an infrastructure standpoint. I always, whenever this question is asked, I always like to preface this by saying in the electronic world, nothing is 100% totally secure when you hear of all of the various entities that have been hacked into. That having been said, the protections that we've put into our network in particular, and you know, there are a couple of other entities that connect up pharmacies to providers as well, are as high as it can be in terms of security rankings, if you will. I mean, this could get very technical, not for me because I don't work that part of it, but you know, to date we have seen some attempts to hack into the infrastructure for ePrescribing, but there has so far been very, very few actual successful attempts. And typically when that does happen, it's because somebody has gotten a hold of a physician's two-factor authentication credential and log-on credentials, and that is how they've been able to get into the system.
Thanks for addressing that, Ken. All right. For those listening today, I did want to take a moment to highlight some resources we have available. I want to let everyone know that the slides from today's presentation are going to be emailed to you, as well as a recording of today's presentation. After the webinar concludes, you'll get that in an email. Here is the one that pertains to what we're talking about today. You'll see our other health IT initiatives here, but this is the ACA resource for ePrescribing in Florida, where we will be updating with news and resources as things change. I also wanted to ask the panel, are there any other resources that maybe your organizations that you work with are promoting about ePrescribing?
Yes, this is Michael Jackson. We have already done a seminar rather down in Sarasota, Florida, about 200 plus pharmacists that were there. We're going to be in the Panhandle of Florida over in Sandestin in January. We're going to do it there, and probably one or two other meetings and webinars we're going to try to facilitate for pharmacists throughout the state for 2020. So this is a constant educational effort. The goal here is to try to keep our pharmacists informed of the revisions or changes, so that when patients have questions, or if they have something that's occurring with their systems, or if there's a need for them to reach out to their software vendor for changes, that they can begin starting that now before they get too far behind.
Thank you, sir, for that.
This is Ken again. I would also remind you that that article that I mentioned that talks about the new version of the script standard, please feel free to email that out to all the participants. I think they'll find it useful. And certainly, Michael, if you want to share that with your membership, please do so.
If I have your permission to reprint it, I will be happy to do that.
Permission granted, and we've got lots of witnesses.
All right, great. And I will be sure to include that in the email attachments that I'll send to everyone attending today. So, folks, we're about 10:45. I want to open this up for some audience questions. For those attending, there's two ways you can ask a question. You can type it through the GoToWebinar panel. Looks like we have one typed in question, and there's a couple coming in. There's also the option to raise your hand through the panel, and we can unmute your line. Once again, this is for whichever panelist would like to answer it. The first question is there anything that will preclude us from filling verbal prescriptions after January 1st, 2020?
So this is Michael Jackson. If you have a verbal prescription after January of 2020, I believe you can fill it. The issue here is just whether or not the prescription, the prescriber is required to electronically transmit that prescription. So I don't think it's changed anything. I think the original law, when it was filed, not the one that was signed into law, did away with all prescriptions other than electronic. And then I think over the discussions during the session, they made some modifications, and things like tamper-resistant prescription blank, that's still a requirement. The laws haven't changed to allow prescriptions to be transmitted by any other means. It's just that the prescriber, if they elect to either orally transmit the prescription or they elect to issue a written prescription, it's done so under the listed exceptions. So the pharmacist is not going to know what those exceptions are, but there's no requirement for the pharmacist to determine that either.
Thanks, Michael. Our next question comes from Deborah, and she's wondering, how would a pharmacy know if a prescriber has a waiver?
This is Jennifer. For us, as I mentioned earlier, as we process waivers for individual prescribers, we will be making that available as a modifier on our license verification page. So our thought is if you wanted to check, you would be able to check via our online license verification page.
Thank you, ma'am. Let's see. Looks like we have a couple more questions. Oh, this is a great one. If an electronic medical records ePrescribing software is down for maintenance, is a provider permitted to drop back to doing a written prescription?
So this is Michael. I'll try to tinker with this one. I probably would prefer Dr. Glisson answer that one. But I'm looking at the list of exceptions. So if you have, and this can happen in Florida, you can have power outages, you can have hiccups in a network, all kind of things could go wrong. And you still have to facilitate care for patients. So in those circumstances, when your electronic system is not working correctly, or you're unable to transmit for any other reason, I think using the historical way of issuing prescriptions to a pharmacy would be appropriate. And I just look at the list of exceptions, and the one exception says it's not required if the practitioner determines that it's not in a patient's best interest. So if the practitioner was waiting for the system to come back online, and the time frame between when it came back online and when the patient needed the medication would be problematic, I think it's in the patient's best interest for the physician to act expeditiously and do what's necessary to care for the patient. So that's my opinion. I probably would defer to Dr. Glisson for his comments.
Yeah, I would agree. I think that you're always putting the patient first will never get you in trouble. And again, it's just documenting in the medical record that your system was down and unable to transmit. The problem is that if the entire EMR is down, then you can't even document. So you'd have to write it on paper and have that scanned in probably. Or if it's just the SureScripts or the network down, you might be able to document it in your EMR and send it, queue it and send it later. So, but I think just making sure you've documented that's in the patient's best interest will get you out of trouble there. And again, I don't think that no one's going to be looking at this as a one-off thing if you do this one or two times. But I think if you have a pattern, if you have 4,000 of those prescriptions, that may be suspicious.
Great, thank you guys. Let's see. Ken, maybe you could answer this one. Pamela is asking if our EHR on the SureScripts website shows a check mark in the EPCS box, does that mean it's been updated?
Yes, that's what it should mean.
Let's see. This is an interesting question. Is Florida going to change law that will allow APRN to prescribe controlled substances for children, specifically ADD meds?
This is Michael Jackson, and great question. I think it's a little bit outside the scope of this webinar, but an interesting question nonetheless. For the moment, I have not seen any proposed statutory changes that are being considered for the 2020 legislative session, but it's not to say that there isn't something in bill drafting to address that. So my recommendation is if the attendees are interested in that, connect with your state professional associations. They're really good at providing information on updated changes. And if that pops out, we'll be glad to let you know.
Thank you, Michael. I'm going to take one more question for this morning. For those of you who have submitted questions and we haven't been able to answer them, we will send you an email reply. The last question is, for providers who accidentally transmit a prescription to the wrong pharmacy, is there a process in place to pull that prescription back and resend it to the correct pharmacy?
So this is Ken. I'll address that. One of the things that I didn't mention with regard to the new version of the ePrescribing standard, well, actually, I take that back. The current version of the ePrescribing standard supports a transaction known as Cancel RX, and it's designed to send a message from a prescriber to a pharmacy canceling any prescription that's been e-prescribed. So in that instance, you would use the prescriber would use a Cancel RX, send it to the pharmacy, and then issue a new electronic prescription. The one thing I would like to point out, even though that transaction has been available as part of the standard for several years, it's not nearly as widely adopted either by EHR systems or pharmacies yet. So there are probably a lot of folks who have not seen this particular functionality, but it is out there. We're encouraging its use. We've heard a lot from the provider community wanting pharmacies to enable their systems to receive these. A lot of that has to do with a lot of the mandates that have been adopted. So yes, there is a way to do it.
Thank you, sir. All right, folks. Unless any of our panelists have any last-minute thoughts they would like to address, I'm going to go ahead and start to wrap up today's webinar. Panelists, did you guys have anything else you wanted to add?
Yeah, actually, it's Michael Jackson. Ken had just shared with you a very interesting process in canceling a prescription that's been transmitted by the practitioner. Ken, could you share with us how that works in reverse when the pharmacy receives a prescription or a pharmacy has not received a prescription that it was supposed to get? How does the pharmacy communicate that back to the prescriber of record?
So just so I understand the question, the pharmacy is expecting an electronic prescription that they have not received?
Correct. Or a pharmacy received an electronic prescription that it was not supposed to receive and needs to notify or send that back to the prescriber.
So there's a transaction that is currently available known as RX Change, and it, while not specifically designed for that use case, could probably be used for the pharmacy to indicate back to the prescriber that you electronically that you sent it to the wrong place. In the instance where, for example, a patient might arrive at the pharmacy and for whatever reason the electronic prescription hasn't been transmitted yet, the new version of the standard is going to have another new transaction known as new RX request, and a pharmacy can send one of those messages to the prescriber just indicating, and it doesn't have to be that specific. They don't even have to know the name of the drug. They could just indicate, patient requests prescription for antibiotic, and hopefully when that arrives at the provider end, they will know what is meant, presuming that they had already told the patient that, I'm going to put you on an antibiotic. So there will be a way for that to happen as well. That too, being a new transaction, is probably not going to be nearly as widely adopted initially, but it is in the suite of new transactions that will be available with the new version of the standard.
Thanks, Michael and Ken. And also to Jennifer and Dr. Glisson, thank you both for being here as well. Today's been really informative. I hope for everyone listening that you've got some good information. Please feel free to use these resources, and you can look forward to this presentation as well as the resources that were referenced in an email directly after we conclude here. With that, to our audience, I'd like to thank you. I know this is a busy time of year for everyone, so thanks for making the time to join us today. And you've got a good email here if you'd like to contact me with any further questions. It's flhii@aka.myflorida.com. Thank you very much to our panelists. This was a really great presentation.
Thank you.
Thank you so much.
All right, everyone. Well, wishing you a happy holiday season, and please be safe out there. All right, talk to you in the new year. Goodbye, everyone.